Caroline Cannon is taking a breather outside after being in the packed ER all morning with her husband. The department at Montreal's Jewish General Hospital is at over 200% capacity.
We got triage within about 20 minutes. It wasn't too bad. There was no one in the hallways. We were sitting, and now the hallways are completely full with people waiting.
Cannon has worked in Quebec hospitals for 18 years and says she's not surprised.
It's not the fault of the doctors or the nurses. It's just we are so short in staff. I used to do schedules, and I can tell you a lot of staff missing, and everyone's doing everything to get more staff in.
Quebec hospitals have been under strain most of December. The situation improved a bit around the holidays, but by midday Wednesday, Montreal emergency rooms were at, on average, 130% capacity. In the Laurentians, north of Montreal, it was 149%.
And it goes back up for between Christmas and New Year's. Then it'll go back a little bit for New Year's. And then after, January 2nd, 3rd, 4th is like one of the worst stretch of the year.
Part of the issue, flu, COVID, and RSV. Just last week, the province said 1 million Quebecers were dealing with respiratory viruses.
And even if the majority of them have mild cases that don't require hospital care, even a small fraction of that showing up to the emergency room is going to overwhelm the healthcare system.
The holiday season also plays a part, limiting options for people who need care.
Other resources that people could have used, like walk-in clinics, like non-urgent care, they tend to sometimes not operate during the holiday season, and so that shunts more people to the emergency rooms.
So, Kwabena, what is the province doing?
So, Renee, the province is urging people to use other resources like calling 811 where they can speak to a nurse or visiting a pharmacist. Now, it's also trying to free up 1,000 beds to allow patients to be transferred out of the ERs. But one ER doctor I spoke to says that there's nowhere to put these patients, so transferring people out of the ERs is like nearly impossible.
Thanks, Kwabena.